Just 2 weeks ago, Ohio Congressman Dennis Kuchinich was adamant on where he stood on health care, telling Fox News he could not vote for the bill without a public option. Remember this?
I signed a commitment with 77 other members of Congress saying that if there was not a robust public option in the health care bill that was presented to the House, I wouldn't vote for it. I kept my word.
Well, that was then, and now he is changing his tune. Now he is a yes without a public option.
All right, Ohio Congressman Dennis Kuchinich joins us live from Washington. Congressman, what's been a heck of a plane ride? You have been on the record everywhere as a firm no without a public option. As a firm no without a public option. Public option.
Without a public option.
You get off the plane and you're a yes
without a public option.
What happened?
No, actually, that's not exactly the way it happened. I did not inform the president of my decision
without a public option
until actually during the press conference. If he was watching it, that's how he learned about it. I listened carefully to the president's concerns, and there are other things that were put into balance, such as I tried everything I could to try to get a public option in the bill, to try to protect the right of states to pursue single payer without a legal attack from insurance companies.
Without a public option.
And when it became very clear to me that nothing I would be able to do was going to change that bill, then I had to look at the bill and the consequences of voting against it.
Without a public option.
The time when I'm considered a swing vote as opposed to the consequence of voting for it, with the hope that down the road we can have more comprehensive health care reform.
Without a public option.
It was not an easy decision.
But he just seemed to have pressured you into it, correct?
No, I wasn't pressured into it. I mean, when you're in public service, it's really important to always consider the impact of your decisions. And when I looked at how I just couldn't get what I wanted, I had to look at the bill as it is and make a decision with the hope that down the road we'll be able to get a more comprehensive health care reform
without a public option
that will include diet, nutrition, complementary alternative medicine, and so many of the other things that I am concerned about, including continuing to push for the states to have the ability to safely pursue a single payer.
Now, Congressman, without a public option, twice in a row you were mentioning down the road. So you make it sound as if this is just phase one. Did the president say to you, okay, go along with me on this right now, and let's get this done, and then down the road I will do my best to get what you want, which is a public option?
Well, he didn't say that with respect to the public option, but what the president did say was that he said that he wanted to work with me to bring about the reforms that I'm interested in without making any particular commitment. And he certainly didn't mention a public option, except he seemed to leave some room
without a public option.
That, provided there's votes in the House, he would be willing, and the Senate, he'd be willing to endorse it. So that's not part of this bill.
So, Congressman, you have the feeling after the sit down with him on Air Force One that this is just phase one in health care without a public option. There's going to be more coming without a public option.
I think that, first of all, you have to remember, I've had several meetings with the president. The trip to Cleveland on Air Force One.
Sir, are you of the opinion that this is just the first step without a public option? You're going to get this through, and then they're going to without a public option. We'll work on it later down the road. Without a public option.
It's the first step, and then I'm going to continue to work on comprehensive reform. And
without a public option.
The president indicated a willingness to work with me without being specific as to the issues.
Congressman Dennis Kuchinich, who's changed his mind and will vote for this bill.
Without a public option. Without a public option. Without a public option.
Thank you very much, Congressman.
Thanks for the chance to be on. Thank you.
Straight ahead.
Fucking bullshit.
Congressman, it's a 2,300-page bill that's only gotten worse.
Without a public option.
As they've come out with their second bill to try to clean up the first bill.
Without a public option.
Congressman, I got to ask you, too, one of the things that have emerged out of some of the details of the 153 pages that have been added to this bill is the hiring of 16,000 IRS agents.
1 century later, a corrupt U.S. Congress committed the biggest theft in world history. They passed Paul Warburg's Federal Reserve Act in 1913, handing over America's gold and silver reserves and total control of America's economy to the Rothschild banksters. Most Americans still believe that the Fed or Federal Reserve is the government. It is not. The Fed is a privately owned banking system whose majority Class A shareholders are the Rothschilds, Warburgs, Kuhn and Loeb, J.P. Morgan, Rockefeller, Israel Seif, and the Lehman Brothers. This private banking cartel is the Fed and is never audited and never pays taxes. They print and design America's money, which displays their symbols of an Egyptian pyramid, a Masonic all-seeing eye, and the words "In God We Trust." Who exactly is the God they trust? They also collect American taxpayers' money through the IRS. Then they loan it back again with interest to pay for roads, bridges, and other public.
To get involved in the whole healthcare process and evaluate insurers and companies who might have a good policy or might have a bad policy, but the IRS will make that decision.
They also collect American taxpayers' money through the IRS.
That's a little scary. I know very few people who are pro-IRS.
$10 billion and 16,000 new IRS agents to make sure that everyone buys the health insurance that the government decides you have to have, making sure that every employer either provides health care to their employees or pays a $2,000 fine. Brian, the American people are asking where are the jobs? And this bill is going to do nothing more than kill job prospects in America. When you raise the cost of employment, make it more difficult for people to hire,
bullshit.
They're going to hire less people.
Except for, I guess I could say that 16,000 new jobs will be created by adding people to the IRS.
Bigger government, heavier hand from the government. This is not what the American people want from their government at this point.
This is interesting. Those Freemasons who are operating out of hospitals are referred to as Knights Hospitalers. They are the Knights Hospitalers. They're the ones that have control over the health in America. The American Medical Association, the American Health Associations, all hospitals come under the Knights Templars, or what they call the Knights Hospitallers.
I got news for you, pal. You ain't
so when you hear all
two
this
things
crying
right
and complaining on the news by the politicians talking about the absolutely prohibitive cost of medical care, what they're saying is our brothers in the Knights of Hospital, the Knights Hospitalers, need some more money.
I don't
so
like
being up everything. We're being had by some very powerful secret societies that control our very life. Everything we see, everything we hear, our food is dominated by them. They're putting chemicals in our food. They're killing our people. They're beating people up in the street. They don't really care. These are fascists. They don't care a thing about you or anybody else. They have only one thing in mind, and that is the direct control over the human race. It's called the New World Order.
Lieutenant Frank Grimes of Chicago Police Department. Are you the man in charge?
That's right.
Well, who am I speaking to?
John Q.
I assume since all the doors are locked, this is a hostage situation. Is that correct?
Okay. Bless me, Father, for I've sinned. I know you do things your own way.
Blood pressure is dropping fast. He's going into cardiac arrest.
But I don't understand.
Mike's heart is useless. He's going to need a transplant or he's going to die.
What made Mike so sick, huh?
Transplant surgery is very expensive.
We got insurance.
There are no provisions in your policy for a procedure of this magnitude.
All right, you want money. I'll get you your money. We've recently switched carriers.
We only give assistance to patients without coverage. I'm sorry, I can't help you. Have you tried Medicaid?
No, you don't qualify.
My son is dying. I'm broke. If I don't qualify, who the hell does? I've done everything I can do. I'm sorry.
Please.
They are releasing him. Now you need to do something.
I'll take care of it.
Hear me? Do something.
The hospital's under new management now. Everybody does exactly what I say. Nobody will get hurt. More hurt. I want my kid's name on the donors list.
This is going to end up bad for you, John.
Police will do whatever is necessary to preserve the lives of these hostages. They're telling me I got to take my son home and watch him die. If you could speak to John Q right now, what would you say to him? I'm there with you and you take care.
5:15.
Frank. Something happens for me.
Are you praying for a baby?
Yes, I'm praying, sweetheart. He's a good kid. You'd like him. I am not gonna bury my son. I got a shot at this guy and I'm gonna take it. My son is gonna bury me. Take the shot.
How's it gonna end, John?
I don't know.
You can do it! Cut his fucking head off!